Hello, I'm Dr. Valerie Walker and welcome to the Medical Moment. Today we're going to be talking about a disease that affects a lot of people. We call it the Great Mimicker because it does so many different things to so many different parts of the body. And that disease we're going to be talking about today is lupus. Some people keep it simple and call it lupus. Some people call it systemic lupus erythematosus or SLE, or sometimes people just call it lupus or discard lupus. And so we're going to go through the different types and we're going to explain the symptoms and mostly what you can do about it so that you don't ever have to go to the doctor and they diagnose you with lupus. So what is lupus? I mean, how does it affect the body in so many different ways that we call it the Great Mimicker, just like we call diabetes the Great Mimicker because it does so many different things to the body that a lot of diseases do that. So let's just focus in today on lupus. Well, first of all, lupus is an inflammation in the connective tissues of the body. And what happens in lupus, believe it or not, is the body's own immune system. And you remember I've told you in previous shows, if you've been keeping up with me, the immune system is like your military, your army, your navy, your Air Force, Marines. So what if all of a sudden they start turning in on us? Well, that's the same thing that happens in patients with lupus, is that their own immune system start attacking normal cells. Now, you know the job of the immune system is to attack anything foreign that hits the body that's not good for you. Then the immune system goes in for the kill. But what happens in lupus patients, we call it autoimmune because we have all these auto antibodies that attacks the body itself, and namely we call it the ANA, the anti-nuclear antibody, because it attacks the nucleus in the cells, which is the heart of the cell. So now you've got your own immune system, your own fighters, they fighting you. And we don't know exactly why. And there again, on a lot of these shows, you'll always hear me say cause is unknown, but we know there are a lot of things that are associated with lupus. And one of the things that we know associated with lupus is that it runs in families, and you can never, I always say, get away from that DNA. A lot of things, if mom, sister, or anybody else got lupus and you start feeling funny or having symptoms, you want to always discuss that family history with your doctor because you may be having symptoms of lupus too. I have a family where the mother and all three of the kids all have lupus, so it does run in family. So number one, even though we don't know the exact cause and don't know why the immune system all of a sudden start fighting you, we do know, number one, that it can run in families. The other thing we know about lupus is that with it being an autoimmune disease, a lot of times with lupus, there are other autoimmune diseases that can be associated with that also. And some of the symptoms that we see are mainly affected by it attacking the body. So what part of the body does it attack? Well, number one, skin rashes. Imagine you woke up one morning. You just woke up and went and looked in the mirror and you have what we call a butterfly rash on your face. A rash that's shaped just like the wings of a butterfly on your face. That's one of the hallmark rashes that we see in patients with lupus, is that rash. We call it the butterfly rash. And your joints start swelling and aching all the time and just hurting all the time. That's another symptom of lupus. You can have inflammation in your kidney because remember now, this is the immune system, so it's attacking all parts of the body. It's not just attacking one. It can attack your kidney, and actually lupus can attack your kidney so bad that you wind up on the kidney transplant list, but they don't want to give you the transplant because of the lupus. So you just in a no-win kind of situation because they figure with a new kidney, those same antibodies will attack the new kidney also. So that make you not a candidate. And it can also affect your heart. Lupus can give you what we call a pericarditis, or endocarditis, all these things that can cause inflammation in your heart. And actually the number one cause of death in patients with lupus is, guess what? It's heart disease. So it can do all kind of things to you. Some of the other symptoms that we see with lupus is fever. fever. You can run like a fever, a low-grade fever. Chest pain. If it starts bothering your heart with all the ditises, as I call it, like endocarditis and pericarditis, then that can be a problem with chest pain also. You could also have hair loss. If you just combing your hair and getting big wads of hair out, that can be a sign of lupus. Dry skin, you just lotioning up and using all the Vaseline the store have on order, but your skin is still dry, that can be a sign of lupus also. Mouth ulcers, or painful ulcers in the mouth, can be a symptom or a sign of lupus. Swollen lymph nodes. And the biggest thing I hear patients tell me all the time, they say, Dr. Walker, I just feel tired. It just feels like my get up and go done got up and went. You just feel tired all the time. So now here you have these skin rashes, you have all this fatigue going on and you have all this inflammation in all the joints that's going on, and that could be a big sign of lupus. And there again, don't forget that red butterfly rash on the face. That's almost classic for lupus, is that red butterfly rash on your face. And so what it does with lupus, it increases your risk of kidney disease, like I said, and heart disease. But guess what? The symptoms of lupus in men and women, they actually differ a whole lot. For instance, in men, what we see a lot of with lupus is seizures. Believe it or not, men can have seizures, even though I usually see a lot of lupus more in women than in men, just in my patient population. But they can have more seizures, more kidney disease, more serositis, which is inflammation around the lining of the lungs and the heart. They have skin problems and peripheral neuropathy. Now, we've done the show. If you didn't watch it, go back and watch the show that we did on neuropathy and those 7 trillion nerves that you have in your body that can get disease. That's in men. In women, we see more relapses. Relapses is you go through periods of remission where the disease is not so active, and relapse when the disease is really active again. And I see that more in my women patients. The white blood cell count can be decreased and down. Raynaud's phenomena, you get this numbness and different colorations in your hands and your fingertips and all. And psychiatric problems such as anxiety and depression. I see that more in my female lupus patients. What we want to talk about now is the onset. So what ages are you when you start seeing signs and symptoms of lupus? I've had patients as young as 15 years old all the way up to 45 years old. So let's just say the age 15 to 45. That'll be a good starting point for us. And how long will it last? It's what we call a chronic condition. And by chronic, we mean long term, meaning we don't see it just going away in the near future. This is something that's probably going to be with you for a while. So probably lifetime. We don't have a cure yet. And that's why we don't know the cause and we don't have a cure. So all we got in the middle of all that is treatment. How would we treat this? Well, the same thing again. We would have to get your complete physical exam. Everything in healthcare, I don't care what it is, it always starts with you getting yourself a complete physical exam, and stay in contact with your doctor. Don't ever think ignoring a problem is going to make it go away. It's not. It's probably going to make it worse. So always stay in tune with your doctor and give them a call like before. Just to recap what we talked about, any swelling in the joints, you feeling tired all the time, you wake up with this weird butterfly rash on your face or rashes elsewhere in the body that you can't get rid of. Those are the things that you need to talk to your doctor about. Always be proactive in your health care. And always tell your doctor about these things based on symptoms. A lot of things we do, we don't find anything on the physical, but we can base it a lot of times on the symptoms that the patients tell us about. And then the doctor's also going to run some blood tests on you to see, exactly what's going on, especially the ANA, the anti-nuclear antibody test. Those are the types of tests that the doctor is going to use on you. There may be a genetic component. And like I said, I have a family, and all 3 of the children children have it. There may be environmental things that may be affecting you that can predispose you to getting lupus. Sunlight, can aggravate lupus, and we don't know if it causes it, but we know it can aggravate it. Smoking cigarettes. I put everything that can happen to a person on smoking, because smoking is really just not a good thing for anybody. Certain infections can do it. And vitamin D deficiency. Always stay on top of your vitamin D level and make sure your doctor checks your level and make sure that you're getting enough vitamin D in your system. So if you've been diagnosed with lupus, you had symptoms, you went to the doctor, they confirmed it, they did the blood test and the other tests that they had gone to do to confirm it, then what? What happens next? Well, first of all, we need to know, again, there is no cure. It's not a pill the doctor can just give you and the lupus is going to be gone tomorrow morning. No, it's a chronic, ongoing illness. So what we have to try to do as physicians is manage those symptoms and try to make them better and keep you in remission as long as we can. NSAIDs, again, those are drugs like ibuprofen and all to control the inflammation and the pain. Corticosteroids for a short period of time. We don't like to use steroids long term because steroids are wonderful medicines. They do a lot for the body, but you can only use them for short periods of time, because after the long term use, then you can start getting into side effects, weight gain, elevated blood sugar associated with cataracts, like all kind of things can come from them. But for the short term, steroids are good to help with the inflammation. Things like anti-malaria drugs we use. Sometimes we use drugs that have been indicated by the FDA for one thing, but we find out it's useful for something else. So we can also use anti-malaria drugs to treat lupus. We can use anti-cancer drugs to treat lupus. Like a lot of patients you'll see, they'll talk about methotrexate. Well, that's initially a cancer drug, but we found out it helped control those symptoms of lupus. So we'll use something that's off-label. If the benefits outweigh the risk, then we can do that. And if it's going to help you live longer and do good. Then we can do things called intravenous immunoglobulin therapy. Those are all therapies, especially levels that, again, your doctor, if all else fails, will talk to you about. We want you to always avoid sunlight and also do the things that are healthy. Keep up with your vitamin D level. Sometimes letting food be your medicine is one of the best tips I can give people. Eat the foods that are good for you. Try to stay away from high-fat foods. Try to make sure you keep up with your fiber, at least 30 grams of fiber a day from fruits and vegetables, whole grain. Make sure you get your exercise and make sure you keep your stress out of your life. Even though we don't have a cure right now for lupus, researchers are working on it day and night. Trust me, behind the scenes, you think nothing is going on and that all these diseases are just going unnoticed. No. I have a lot of friends who are research scientists. They're trying to find cures for these things every day, and we've come a long, long way. So if you have any of the symptoms we talked about, joint swelling, weird rashes that won't go away, and just not tired and just not feeling yourself, you want to go and talk to your doctor and ask them, could these be signs of lupus? We don't have a cure, but we have treatments that try our best to keep you in remission. I'm Dr. Valerie Walker, and this has been our story on lupus. We'll see you for another exciting episode of The Medical Moment.